Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah, Manager of Community Health Improvement at Kaleida Health. You are listening to us on WUFO, Power 96.5 FM, WUFO AM 1080, or you might be listening, or you might be streaming us and listening to the program. But I want to welcome you to the Great Lakes Health Radio program, Kaleida Health. And I just want to mention that Kaleida Health, we are Buffalo General Hospital, Millard Fillmore Suburban, and Oishei, the Children's Hospital. The new name is now Golisano Children's Hospital of Buffalo. So what was before Oishei Children's Hospital is now Golisano Children's Hospital of Buffalo. We also have the Visiting Nursing Association, and I do believe I said Millard Fillmore Suburban, and the Gates Vascular Institute. We have two long-term care facilities. That is High Point on Michigan and DeGraff. DeGraff in North Tonawanda. We're also in North Tonawanda on the same campus as DeGraff is a urgent care, but it's not urgent care, but it's a DeGraff Care emergency medical center where you can still go for your health care, especially if it's an emergency. And we have health clinics throughout. We have clinics throughout Buffalo, the south of the city, north of the city, Olean, Bradford. So we are in many locations, and it's Kaleida Health, over 13,000 employees. And our guest for today, good morning, Roberto. How are you?
Good morning, Francesca. Thank you for having me in your show.
Oh, you're welcome. And Roberto is Roberto Bonilla. Bonilla?
Yes, Bonilla. Yes.
Okay, Roberto Bonilla, and he is the manager of Community Health Improvement. Same title as I have, but we work in different areas. Our topic today is the 1115 waiver screening for individuals who are on Medicaid or Medicaid eligible. And I'll let Roberto explain that to you. The reason why I have Roberto, I've been working in this department now for about 3 weeks, and the things that the services, this department of health, community health improvement has available to the community is mind blowing. One of the things we have, and that's why we have Roberto on the show to talk about it, are microwaves and refrigerators. And how do you qualify for this? What is an 1115 waiver? So anyway, Roberto, if you could just begin by saying, please explain the 1115 waiver and why it's important to our Western New York community.
Of course, Francesca. So the 1115, I'm just going to start saying that the 1115 waiver is a Medicaid initiative to screen all Medicaid members for health-related social needs. These funds are assigned by Medicaid to Western New York, and it's important for our community to take this advantage of this funds and these resources that are available for them. Our role in the 1115 waiver is basically to screen all individuals that have an active Medicaid, so we can identify their health-related social needs and then help them navigate and link with those service providers that will deliver those services to them.
Now, I've heard of other organizations with 1115 waivers. And so today we're just speaking about the Kaleida. And how can one apply for the 1115 waiver? How do you go about that?
Great question. They basically have the WINIC is the main entity that manage all these social care networks, but Medicaid members can reach out to us directly. I can provide our phone numbers. It only takes between 10-15 minutes to do the first screening and the eligibility screen. So they can reach out to our team here at Kaleida Health, I'm going to provide you with two phone numbers. The first one will be 716-370-1051 and 716-387-2632. We will take their information. All they need basically is the SIN number, the identification number from Medicaid. If not, we can help them get that number. And again, 10 minutes, we will ask a series of questions and screen them and determine if they qualify for services.
Now, I remember watching you talk to people when the Near East and West Side Task Force had Passport to Wellness. So were people having a conversation with you and applying for this 1115 waiver at the same time?
Correct. Yes, we will ask questions regarding housing, nutrition, transportation, and we would identify those health-related social needs that Medicaid members will have, and we can help them connect with services. Yes.
Okay, because I was observing. Um, so I was also reading, or maybe it was looking at the flyer where it talked about another term that's often used, social determinants of health, and I call it social determinants of life. But how does the 1115 waiver work with individuals and families who are part of what we now call social determinants of health, and I call social determinants of life? How do the two work together?
Great question. We will, on the 1115, obviously, this is a screening, so we will identify those those social needs that families will have, individuals will have, so we can close those gaps, so we can reduce this health disparities in our community. Again, we will identify housing needs, nutrition, transportation needs, even cooking supplies that you mentioned. We can identify individuals that need a new refrigerator because they don't have one to, so they can store their food, and microwave cooking supplies. So we want to help individuals close these gaps and and reduce these disparities in our community.
Now, you just mentioned a few things. What services, like what are the questions that would trigger if someone needed an appliance? And what's the other, you said, yeah, what are some of the questions that are asked when the person who is applying, that you are able to prove that they are on Medicaid? So what are then the questions that would make one eligible for the services? And so let's start with the kitchen. And so what are the things you would supply for a kitchen? What makes one eligible? And does someone come to the house to make sure that that's what they need?
Great question again. So basically, Medicaid will identify individuals that need support. That's the first thing that Medicaid will do. This screening, most of the time, identified automatically. Medicaid members in need with medical condition. If that's not the case, like it happens with a lot of children, we can also send an attestation form to your medical provider for them to confirm that the Medicaid member has a medical condition and is entitled and eligible for these extra services. Now, that's one part. The other part is we ask individuals if they have stress finding food. And if they said yes, very often I don't find fresh vegetables. I don't have access to a fresh and healthy products. That will be one question, and we will refer that individual for food provisions. We also ask them, how is your refrigerator working? How do you have a microwave? If they say no, this is a verbal answer. We will not send no one to their homes to verify this information. This is all verbal, And if they need a refrigerator, we will refer them to receive a new refrigerator. Housing, we ask, do you have a steady housing where to stay every night? Sometimes they don't have, they might feel homeless, and we that way we can refer them for housing assistance. Transportation, do you have a reliable transportation? This is just questions that are verbal questions. We ask them, they answer yes, no. The same for like pest control. If they have, we can also help with home remediations. That's a great one for asthma, and for pest control. But again, this is all free. Also, I have to mention all these services are free of charge. Medicaid is not going to charge no one for these extra services and these resources. And most of the time is a verbal answer.
Hmm. You know what? Can you just say what you just said? Can you, because I know we have listeners who are also speaking Spanish. Can you just repeat what you said about the services that are free and no one goes into your home? Can you just say that in Spanish? And so just in case we have listeners who understand Spanish, can you do that?
Claro que sí, of course.
Okay.
Nosotros aquí en Kelaida estamos haciendo estas preguntas a miembros de Medicaid que tienen Medicaid activo para identificar necesidades sociales como provisiones de alimentos, utensilios de cocina que puedan necesitar las familias, como refrigeradores, microondas, utensilios de cocina. Podemos ayudar a remediar los problemas en la casa con asma. Cuando tienen niños que tienen asma o adultos que tienen asma, podemos ayudar. Si tienen insectos en la casa, también podemos ayudar. Con transportación, si no tienes hogar, nos puedes llamar, podemos conectarte con agencias que dan servicios de casas para que puedas obtener un hogar. Todos estos servicios son gratuitos. Nos puedes llamar al teléfono 716-370-1051 o al 716-387-2632. De nuevo, es un servicio gratuito, solamente nos toma 10 a 15 minutos entrevistarte y poder conectarte con servicios. Muchas gracias y esperamos tu llamada aquí en Kelaida Health. Thank you, Francesca.
And you're welcome. And did you say your name and give the phone number as well?
Yes, I did. Roberto
Okay.
Bonilla y mi teléfono otra vez, 716-370-1051. Yes, thank you.
Thank you. This information is just way too important for just one language. I mean, and I know we've discussed this at our meetings in interpretation. So is it you? So how does someone get in touch with you to come to their church or their health fair, or is there a team? How do you work? I mean this is huge. How many people in Western New York are on Medicaid? Do you know how many people?
Oh my God, it's really high. I don't know exactly the exact number, but as Kelaida employees, we know that 80% of or more of our patients sometimes are Medicaid, so it's a reflection of the community too, I will say, right?
Right.
So yes, it's a lot of people that have this opportunity to take advantage and to have those gaps closed, and we here to assist you. And please, you can reach out to me at my phone number that I give, and I will give it again, 716-370-1051. Please let us know when you have a community event at your church, any community event that you might have, even in different, if you know other cultures that we have in the city of Buffalo. We have translators. We can help people in other languages, like Francesca mentioned before. But please let us know when your activity is, and we will go there and support our community like we always do. We work with the schools, with church. We work with anyone in the community that wants our community to continue to grow and be healthy.
Thank you. You had said, so if someone needs a refrigerator, is it a full refrigerator? Or is it like a little college refrigerator? Like what kind of refrigerator is it?
Good question. It has a max dollar amount by Medicaid, so I have not seen the refrigerator, but it's not a. If people request a mini refrigerator, they can actually get a mini refrigerator. I believe the dollar amount that they can go up to is $600 for a refrigerator. So, but I mean, they use Lowe's, they use companies out there that will deliver these refrigerators, and the service providers always coordinate the logistics with the Medicaid members and try to meet as much as they can those needs.
And the other thing you had mentioned, you said so in case someone needs utensils. Did you say utensils?
Yeah, cookingware, silver plate, silverware, a new set for a plate set, nice glass cups, a set of knives to cook, to help you cook, and measure cups, anything that you need, air fryer.
Air
Uh,
fryer.
yeah, they can get an air fryer.
Great.
Anything that they will do, the service provider will contact the member and they will discuss their needs. And if it's available, they will get this service. Yes.
Wow, that's amazing. And a microwave you said as well,
And a
right?
microwave of weight as well, correct.
Mm-hmm. When you talk about transportation, what type of services are you able to provide the family on the east or west side? Um, what types of transportation do you provide?
That's a great question. The waiver provide non-medical transportation need because they already have the Medicaid cap, stuff like that
Oh, I see.
for medical need. There will be no medical needs. It can be to address your housing needs with social services, to go to the court for an eviction or any court, unfortunately, any court date that you might have. It will help you go and get food supplies for your family, to go to the supermarket. They may be able to help you with that. Any need that is not medical related, these social providers will connect Medicaid members with whatever they need might be.
Mhm. Now, is it you or slash your team that helps the connection, or is it up to the individual? So let's say to make that connection.
That's a great question, Francesca. We are screeners, which is the first phase to start, and then we are also navigators. Navigators mean we will do the eligibility screening for them, and we will connect them with service providers for whatever need they have. What I'm saying about service providers is we have a number of service providers or agencies that are providing food provisions. To members. So we can, if we have two or three in their area, we can mention it to the member and they can select one. Sometimes people are spreading the word, oh, give me this agency or that agency. They already know which, the services that these agencies are providing, either in food provisions or cooking supplies or transportation or housing. So they can select the agency also. But
Mhm.
we can provide the names of who's available at the
Right.
time of the screening, and they can select. Yes.
And is it a one and done communication? So once you see the client and you give them the information, if they have questions, can they call you back or is it one and done?
No. Yes. Absolutely. We can help you navigate through. We can get you navigate throughout your services, and this screening is once a year. We can, if you qualify for services, we can help you navigate throughout the time. You can call us every day, whenever. We will assist you with that navigation, that communication with the service providers. Um, but if you have a life-changing event, like moving to a new home, lost a job,
Or you
lost
have cancer
lost a
diagnosis or something.
something, you can actually get another screening done if you had a lifetime changing event. Yes.
Okay. Okay. Well, that's and again, that would be up to giving you or your team a call.
Yes, we are here. And again, I have the phone numbers 716-370-1051. Please call us. We're here to assist you and support.
Thank you. How about now? And we didn't mention because there are thousands of people that gather every Sunday at different houses of faith, homes of faith. Do you or your team go out on Sundays?
We can coordinate, of course. We can coordinate. We're here to serve the community. So if an opportunity presents, we can be there in present and support our community. Yes, just call us and let us know, and we will be there present for you.
Oh, okay. All righty. How about anything else? We have a few minutes left, but at this point, I'm going to stop and let you tell tell the listeners something that we haven't covered.
Well, I think we covered the most part, but again, this screening only takes 10-15 minutes. We can screen every single member of your household. So it's not only one person that we will screen everyone. And if multiple household members qualify for services, they can receive these services individually too. We come across sometimes two families living in one home. If both families are green and both qualify, both families will receive the services at the same unit if that's the case. Again, we want to close those social determinants of health. This is a great opportunity for us to assist you and support you in your need. So please feel free to call. We're here. This is what we do. This is what we love to do, to serve you and help you. So feel free to call us at any time. Text us. You can also text if that's your if you wish to do that. You can also text at 716-387-2632. Please, this service is for you, and we are excited to be part of this initiative by Medicaid because we know that it's impacting our community, and that's what we want to see.
Yeah, and again, don't be ashamed. Another question. You said you can screen every member in the household, but if there are, let's say it's a flat and there are 8 people living in the house in the one flat, they wouldn't each receive their own microwave, would they?
Well, no, they might if they're moving away in a month. We don't know, but they qualify.
Okay,
They
they
might
might.
receive that. Yeah, it's a case by case. They can discuss that with the service provider, but if the need is there, um, they will receive the service.
And if someone is, a listener and they heard you speak Spanish, I'm just wondering, do you speak any other language that you would be able to interpret?
I'm trying to continue to learn Italiano and Portuguese, but not there yet.
Not there yet. Okay. So as you know, as you heard Roberto translate in Spanish, so if it's an event where the majority of your population is Spanish speaking, think about having Roberto from Kaleida Health manage your community health improvement at one of the tables. And again, there's also someone from our team who does lead prevention and right, lead prevention, lead abatement.
Correct. Yes, we have a team that does a lead prevention. We have care coordination programs. Yeah, so we can help in many ways. And this screening is like a starting conversation. It comes many times, Francesca, that we referral families and individual to other services that are not part of the Medicaid waiver. But as you know, as Kaleida Health, we have so many resources that we can help families connect with providers, connect with care coordination, with whatever their need is. So this is a great opportunity of having a conversation, and help our community.
Yeah, so and that's also part of the team. We have like Roberto said, this the screening, 1115 waiver screening, lead prevention, care coordination, doulas, someone very knowledgeable and talking to you and your group about breastfeeding to women, So we have it's an amazing department, and our the it's led by Vicki Landis, and Vicki is an incredible supervisor. Um, Coordinating all of these different services for the community. And Roberto is just one of many of our many of the team members that I work with, who you will be hearing from throughout the year, and also you will be. This is a show that will also be not only repeated but lives on our website. All the Great Lakes Health radio programs, I should say the past 3 or 4 years, if you go to Kaleida Health website or Google Great Lakes Health Radio, comma, Kaleida Health, Kaleida, you will hear this program as well as other past programs that you may want to share with your PTA, your PTO, your Girl Scout troop, your Boy Scout troop, your deacons, your deaconesses. The list goes on and on. Your healthcare providers. So Roberto, I want to thank you so much for being our guest this morning on the Great Lakes Health radio program. Thank you, Roberto.
Well, thank you, Francesca, for having me in this great show of yours. And I'm glad to be here, and hopefully we can continue to help our community and supporting them. Thank you for having me.
Oh, you're welcome. And look for us in the community, because we're back. We never left, but we are back. 100% full steam. And on that note, I want to thank you for listening to the Great Lakes Health radio program here on WUFO. And I'm your host, Francesca Messiah, Manager, Community Health Improvement at Kaleida Health. Next week, you will hear from my esteemed colleague from ECMC, and that is Cindy Bass. And until then, stay warm, be comfortable, and cheers to your wellness. And now on to part 2. Good morning, good morning, good morning. And thank you for either tuning in to the Great Lakes Health radio program on Power 96.5 WUFO FM or WUFO AM, that's 1080, or you might be listening through Google or another one of the search engines. But anyway, thank you for staying with us. I'm Francesca Messiah from Kaleida Health, Manager, Workforce Development. And the second part of our show today, we're talking about fatty liver disease. The past few weeks, we've been talking about hepatitis C and HIV and their impact on the African American community, and very detailed. And we also want you to make sure you ask your physicians, your primary care physician or your nurse practitioner about getting making sure you get the blood work to make sure you don't have hepatitis C or HIV, or today what we're talking about, fatty liver disease. Well, our guests for today, 2 of our guests are not a stranger, and I'm still introducing them. We have Dr. Ken Snyder, who is a Chief Physician Quality Officer at Kaleida Health. Good morning, Dr. Snyder. How are you today?
Good morning, Francesca. Thank you once again for having me and for all you do for our community. Appreciate you.
Oh, you're welcome. And we have Dr. Talal, and Dr. Andrew Talal is a gastroenterologist. And what is MPG, Dr. Talal?
So actually, Master in Public Health, MPH.
Oh, MPH. Okay, Master of Public Health. And he's an also at Buffalo General Medical Center. As I said, he's a gastroenterologist.
Gastroenterologist. Thank you very much.
Thank you.
And also Professor of Medicine at the University of Buffalo.
And yes, thank you. And also Professor of Medicine at the University of Buffalo. And then new to our show, we have Dr. Daria. And Dr. Daria is a Director of Liver Services. And Dr. Daria, are you at Buffalo General Medical Center?
I am at the University of Buffalo.
at the University of Buffalo. We're all in the same family. So thank you. And thank you for being our guest. And I want to thank all three of you, Dr. Snyder, Dr. Talal, and Dr. Daria. Well, on with our topic. Our topic for today and our questions is fatty liver disease. Dr. Talal, what is fatty liver disease? And for all of those who kind of forget from biology or chemistry, what is the purpose of the liver?
Thank you very much for the invitation to speak to you today. And it is indeed a pleasure to describe the liver for your audience, the organ for which I've been working the last 30 years. So really the purpose of the liver is multifactorial. So the liver filters blood to remove toxin and waste products. It produces nutrients for energy, produces bile to break down fats, serves as a storage site for many different types of body processes, including glucose, vitamins, iron, and also has other roles such as regulating proteins that are involved in blood clotting, maintaining blood sugar levels, and synthesizing proteins. And so it's really a very important organ and one that you really want to take care of. The second part of your question, or the first part, what metabolic syndrome is really a cluster of conditions that affect our metabolism. And we refer to these as a group of conditions that usually consist of diabetes, high cholesterol, high blood pressure, obesity, and high fat content within the liver. The term nowadays, very recently within the last 2 years, has been called MASLD, or the complicated term of metabolic dysfunction associated steatotic liver disease. And so it's really not related to dietary fat content, but is due to the fat produced within the liver. And what happens is that the fat is stored within the liver cells. It's not excreted, and a little fat in the liver cell is normal. But what happens in this situation is that the fat can really overtake the normal function of the liver. You can get inflammation, which can result in liver damage. Inflammation, being those cells that are meant to protect against an infection, can actually be recruited to the liver inappropriately and for reasons which we really don't understand. And in this situation, the inflammatory cells attack the liver, even though there's no infection. And over many years, this attack on the liver can overcome the liver's normal process, wound healing process, normal process of repairing itself, and can result in scarring that can result in cirrhosis. And I'm going to go on for just one more minute. Cirrhosis is what we call complete scarring of the liver and can be compensated or decompensated. In compensated cirrhosis, the liver is able to make the things that it should be making. In decompensated cirrhosis, the liver is not able to make the products that it should be making that I described earlier. And people who have decompensated cirrhosis can have thinking disturbances, fluid in their belly, and in their feet, easy bruising, easy bleeding, as well as other symptoms.
That is a lot. Okay. Wow. Yeah. Thank you. Dr. Daria, what are the demographics for, I'm still going to call it fatty liver disease because that's what most of our listeners will remember at this point, because what was the other term you used? MASLD?
MASLD. MASLD.
Okay, MASLD. So MASLD is also known as fatty liver disease. So Dr. Daria, what are the demographics in Western New York for persons with MASLD, or formerly known as fatty liver disease? And who was the greatest risk of having MASLD, also known as fatty liver disease?
Hi, thank you for having me on your show. So I'll answer the second question before the first question. And the second question is, who is at the greatest risk of having MASLD. So as Dr. Talal was talking about metabolic syndrome, it's those people who have diabetes and obesity, they should be screened for MASLD, because having 2 or 3 components of metabolic syndrome, it could mean that you actually have other components of metabolic syndrome as well. And since MASLD is one component of metabolic syndrome, it makes sense that you can have multiple components. Regarding the demographics, we often see many Hispanics and African Americans who can have MASLD, but it can also affect Caucasians as well. There has been a gene that was identified in the Hispanic population that causes increased inflammation in the liver. So this is one reason why Hispanics are affected more than others.
And does this have anything, I mean, and this is either for Dr. Talal, Dr. Daria, Dr. Snyder, does drinking have anything? I mean, when, years ago when you thought about liver disease, you always thought it was, automatically associated with heavy drinking. Is that true? Is that a myth?
So I can answer that question. Before fatty liver was termed MASLD, it was actually called non-alcoholic fatty liver disease. So meaning if you drink alcohol, then you couldn't be diagnosed with non-alcoholic fatty liver disease. In fact, that would be called alcohol fatty liver disease. But to answer your question about alcohol affecting the liver, yes, it does affect the liver, but usually that's a different disease than what we see in MASLD. I just wanted to add to the alcohol, because alcohol can be part of many people's lifestyle. So having a sedentary lifestyle is definitely a risk factor for MASLD. You might ask, what does a sedentary lifestyle mean? Well, that usually means people who do not have a healthy diet and people who do not exercise routinely. They can develop weight, and it can affect the liver because of the extra fat that is in the liver.
Okay, and I guess the way I look at sedentary, sometimes people may go from their car to the garage to work, into work, back to their car, back to home, and never really get any exercise in between. Okay, moving on. Besides the liver, Dr. Talal, does this disease affect any other organ or organs in the body?
Yes, it's really a syndrome, meaning that it affects many different organs. But the biggest ones to be concerned about are, besides the liver, are diabetes, the high blood pressure, high cholesterol, and obesity. And so some of the other organs, those are the other entities that can be associated with MASLD. But really the other organs to be thinking about most commonly would be the heart, the kidneys, the skin, and the pancreas. And so those would be the ones that we routinely check when we follow patients up who might have MASLD.
Mm-hmm. Dr. Daria, how would a listener know if they have MASLD, formerly known as fatty liver disease?
Can I take the introduction to that question?
Sure,
because
of course.
I'd like to repeat what happened to me yesterday. I was at the gym, and somebody came up to me and said, "You cured my hepatitis C 10 years ago. I'm wondering now, how do I know if I have fatty liver?" And so my answer to him was, we have a very good test for you nowadays called FibroScan. And I'm happy to turn the floor over to Dr. Daria to tell you more about the FibroScan.
Thank you, Dr. Talal. So we have the FibroScan at University of Buffalo, and this FibroScan can measure the fat content as well as the scarring that's in the liver. It's basically a modified version of an ultrasound, and it uses sound waves to assess the liver. It is completely painless and non-invasive. The only preparation is fasting for 3 hours prior to the exam. It can be done in almost everybody, except those with morbid obesity or fluid in the belly. Also, if you have a cardiac pacemaker, then you should not have a FibroScan exam. Another way to find out if you may have MASLD is by liver enzyme test. So we have liver enzymes, and if they are elevated more than normal, these can be discussed with your primary care doctor and possibly refer to a FibroScan. Another way is an ultrasound, because ultrasound can actually look for liver cancer in people who have cirrhosis, but it cannot reliably look for fat and scarring in the liver. That's why a FibroScan is preferred over an ultrasound. Lastly, there is another test called the liver biopsy. And the liver biopsy, basically, we take a sample of tissue from the liver and we look at it under a microscope. And this remains the most accurate test. It is, in fact, the gold standard for diagnosing MASLD. And it does have some risk and pain associated, whereas the FibroScan is risk-free and completely painless. I also wanted to say that there is a more severe, more progressive form of MASLD, and it is called MASH, M-A-S-H, and this stands for Metabolic Dysfunction Associated Steatohepatitis. Steatohepatitis means inflammation of the liver in association with high fat in the liver cells. Now, the difference between MASH and MASLD is that people who are younger and typically have a normal BMI and they have a healthy lifestyle with diet and exercise, they can still be affected by MASH because it plays more of a genetic role.
Francesca,
Yes.
I'm gonna jump in here for a minute because I think if there's one thing I want our listeners to understand, it's how complex this organ is and how blessed we are to have the specialists that we have in this area.
Absolutely.
We had mentioned that Dr. Talal was recently awarded one of the top 3 awards in the nation around research from Corey Grant around his work in this area. I think the reason this show is so important isn't that the community needs to know this information. The community needs to know this. There are things that we can reverse, and there are things that we can do to reverse things. Once the liver is damaged beyond a point, it becomes extremely complex for that individual because we don't necessarily have the ability to reverse and fix this organ. And what we talked about last week the last show leading into this show, this is why the state mandate of the screening for viral hepatitis and its impact on the organ long term, because people just wouldn't know they had it until sometimes it's too late, or the ability to get comprehensive metabolic profiles with their primary care doctor and assess and check for liver function and liver disease, and then getting into the hands of these specialists. So the real message to this group is we have some of the worldwide best expertise in our community on this organ. And the community needs to understand that part of the syndromes of metabolic disease that affect our whole body, high blood pressure, diabetes, hypertension, our diet, and sedentary lifestyle can have silent effects on this organ as well. And we need to have an awareness of that.
Absolutely. I mean, and I want to say that, we are doing the show. It is Juneteenth Saturday. And I know if you are concerned, like I am, just listening to today's show, if you're at Juneteenth today, between the hours of 10 a.m. and 4 p.m., please stop by the Health Pavilion if you don't have a primary care, because our Kaleida Health Hurdle Elmwood clinic will be there. And if you need a primary care, if you need to begin to get all of this information sorted and you need to get screened, please stop by the health pavilion and visit one of our staff from the Elmwood Elmwood Medical Clinic. And I know they are taking new patients. So I just had to throw that in there. If someone's listening to the show and they're feeling concerned that they just want to get checked up. So thank you. But back to prevention, back to what Dr. Snyder was talking about prevention. How would the listener know? What should they do? Is this a typical, and I know we talked about, you just mentioned New York State mandates, but is this something that when you're a certain age, is it a blood test? Is it a certain age at which it has to be done by this test has to be done by medical, by your primary care, checking at your liver and different complications? How would the person in the community know to ask to have this and make sure this is being covered?
So I'll handle that, Dr. Talal. Thank you very much, Francesca, for the question, and thank you for the announcement. It's very of the upcoming primary care opportunities to engage with primary care, because that's very important. In terms of knowing if one has the infection, one has the MASLD or MASH, that's one of the reasons that we wanted to do the show with you today, was because it is important that the public have awareness of this entity. And usually there is no one test like viral hepatitis, like exists for viral hepatitis, that can be done to diagnose MASH or MASLD. So usually it's because somebody has an ultrasound and there's a notation of fat on the ultrasound, or they have elevated liver enzymes, and that is those two are the primary ways in which the disease will be diagnosed. Another way is by in certain high-risk populations. So we already mentioned a gene that exists in individuals of Hispanic ethnicity. We also have noted that many diabetics have this disease. It occurs in up to 50% or more of diabetics. And so anybody who has diabetes routinely should be screened with the FibroScan. And in terms of prevention, the most important aspect is following good health practices, eating foods, Mediterranean diet, getting exercise, and exercise really has been shown to reverse, at least in the earlier stages, to reverse the complications of this disease.
Yeah, thank you. And I know that the other day, this past Saturday, at JFK Park here in Buffalo by the old Sheehan Hospital, there was a community outreach for a woman by the name of Gail Wells. But my point is, they were giving out free plants that were vegetable plants, tomatoes, peppers. They had another vegetable. I've never grown vegetables before, but I'm going to try this year, and because a lot of our listeners some of our listeners live in food deserts. So you can also begin to grow some of your own vegetables. Some of them you can grow inside of your house. And there are many community gardens throughout Buffalo, several throughout Buffalo. If you're interested, please give me a call, 716-863-8717. I can share where these community gardens, where you can get maybe for a small fee, but sometimes it's free, fruits and vegetables. So I just had to put that in there. Okay, before we talk about more in the area of prevention, you've mentioned on more than one occasion fluid in the belly. Don't all stomachs have fluid? What does that mean? Fluid in the belly.
So there's a particular problem that exists that develops when people have very end-stage liver disease, whether it's due to alcohol, whether it's due to viral hepatitis, as we've discussed, or whether it's due to MASLD or MASH. in that the liver cannot produce the proteins that keep the blood in the blood vessels. And so you get leakage of blood, of fluid into body cavities where it shouldn't be. And that can be in the belly or edema or swelling in the feet. And what we're talking about is really, when I say fluid in the belly, really is massive amounts, liters of fluid that can really become very difficult to manage because people may have to have different approaches to treatment. But this is one of the manifestations of end-stage liver disease.
Yeah, and I know what you mean. I now know it exactly what you mean. So how about, is this hereditary? And again, I know I talked about prevention. What are some prevention tips? I know you talked about exercise. Like, is bike riding any better than walking, any better than running? How about all of these sugary drinks that we see advertised? Is that something we need to leave out? I'm just looking at prevention.
Francesca, I'm going to take a start at this and let our colleagues jump in as well.
Okay.
When we have excess calorie, excess carbohydrate that we aren't burning or using, our body stores it, and it stores it anywhere. And if it's not used up in muscle or active muscle tissue where it's needed right away, it can start to go to all of our organs. And that visceral fat can be deadly. And so sometimes actually people that have belly fat can store fat. It might even be safer than in the viscera and in our organ systems, because the fat starts to not allow the organs to work optimally. Dr. Talal mentioned this about the heart, right? So it can be in each organ. So now what we're talking about is excess fat that we are consuming through carbohydrate or other that is not being used, that ultimately is stored for what should be running a marathon or some form of active use, that then is congesting the normal function of the organ. And that's really what we're talking about when we talk about metabolic syndrome and what's leading to the chronic disease throughout our entire community. Dr. Talal or Dr. Daria, if you want to expand.
Sure. I'll say, with regards to exercise, it's been shown quite nicely through several studies on the liver that if somebody loses 5% of their body weight, but through whatever means, bicycling, running, walking, you can actually decrease the inflammation, those cells in the liver that are promoting the scarring. And if you lose up to 10%, at least 10%, you can actually have get decrease in the scarring. And so there's many, many years. It may take up to 20 or 30 years for the end-stage liver disease to develop. So there's plenty of time for people to get involved and to start working with a trainer or with a registered dietitian in order to try and improve their eating and exercise habits.
Yeah, and I was going to say, if you don't have the extra money for a trainer or the extra money for for the other things, I have to say, a couple of years ago for Lent, I gave up sweets, and it took me 2 years. But I would say prayer, because we have a very faith-based audience, sometimes you just need to pray that when you see that peach cobbler or you see that donut, you just have to pray to a higher being not to eat it, because it's going to mess you. It really will, it's not good for your system. And I just had to throw that in there. Dr. Daria, and any thoughts on any comments about exercise or getting along prevention? Water? How about water, Dr. Daria? How important is it for people to drink water versus black coffee? And is water important for the system when it comes to formerly fatty liver disease?
Yes, definitely. Drinking water is an important part for the body just overall, but especially for the liver, and it should be part of a healthy diet. Weight loss is a well-proven prevention approach for MASLD. Loss of 5% of body weight results in decreased inflammation, and loss of 10% body weight can result in decreased scarring in the liver. So just going by those numbers, a little bit can have a tremendous impact.
And does it matter if water has, like, people add like the flavors, I call them flavor crystals, I don't know what's in there, or if it's soda, if it's fizzy water or non-fizzy, does it matter what kind of water, or because they just do so many things how to mask the flavor water?
Well, plain water without any additives would be the best. As Dr. Snyder was talking about earlier, soda has a lot of unnecessary carbohydrates and excessive sugars. So this sugar is broken down into glucose and fat that can distribute itself among the body, especially the liver. So, you want to stick to natural water is the best, in my opinion.
Mm-hmm. Okay. And
we recommend the Mediterranean diet, because the Mediterranean diet is high in vegetables, high in fruits, and high in legumes. Legumes includes foods such as beans, nuts, mushrooms, and of course, seafood and white meat is very important. Whole grains as well.
How about the people say it doesn't taste good unless it has cheese or a few pads of butter?
I would say everything in moderation.
Okay, that's fair. You know what? We are out of time. And we will be repeating the show at least one other time, because the topic is so important and we've covered a lot of information. And I just want to thank you, Dr. Snyder, Dr. Talal, and Dr. Daria for being our guests this morning on the Great Lakes Health Radio program, and the topic, fatty liver disease, and which is the correct term is MASLD.
MASLD, excellent.
MASLD, yes. Thank you. So I just want to thank you. And our time is up. I can't believe it, but it is. So thank you. Next week, you'll hear from our host, Cindy Bass from ECMC. And in 2 weeks, God be willing, you'll hear from me, Francesca Messiah, Kaleida Health Manager, Workforce Development. Thank you for listening. Bye-bye.